Good afternoon. Thanks for joining me on the program Healthy Living. I'm your host, Oluije Orikokai, standing in for Adesuwa Osa-Owage. Today on Healthy Living, we'll be looking at an infectious disease that affects both man and woman. Yes, in most cases, we find the men blaming the women that it's their fault. And in some other cases, women say, hey, I'm not just the only one to be blamed. You also, as a man, we need to go do some checkup. Now, today we'll be looking at infertility in women, yes. And to do justice to that is Dr. Rafiu Sofiat, a gynecologist. Good afternoon.
Good afternoon.
Your name, please.
My name is Sophia Tayobami Yusuf. I'm a senior registrar at the Department of Obstetrics and Gynecology, University of Benin Teaching Hospital.
All right, Doc, we'll be looking at infertility in women. Now, I would like to ask you, what is infertility?
Infertility, simply put, it's the inability to achieve pregnancy after 1 year of trying to get pregnant. So a woman is said to be infertile if after 1 year of having regular unprotected sexual intercourse, she's still not able to achieve pregnancy. Then we can actually say that, okay, there's a form of infertility. So it takes a duration of 1 year. The woman must be having regular intercourse, vaginal intercourse. She's not using any form of contraception or any form of family planning, and she's still not able to get pregnant. Then we can say that this woman has some form of infertility.
Okay, so infertility, is it a common disease?
Infertility is actually a common thing that women present to the clinic for. For example, now, if women present to the gynecological clinic, if we say like 100 women present to gynecological clinic, about 60% of them are trying to get pregnant, and that's what brings them. So we can actually say that it's actually a common problem in women. Most women come to the clinic just for the fact that they want to get pregnant, and because of the premium that it's placed on childbearing in our society, it's actually a problem that most women comes for them to be investigated for.
Okay, now there's this saying that once a woman is above 30, she's prone to this infectious disease. How true is it?
You need to be specific. Infectious disease. Do you mean that if the woman is above 30,
yes,
she's prone to infertility, or she's prone to?
No, she's prone to infertility.
Okay. Infertility per se is, it can actually affect any woman of any age. Okay. A woman that is 24 years old can actually have some forms of infertility. A woman that is 30 years old can have some forms of infertility. But what is known is that the higher the age of a woman, the more prone the woman is to infertility. And this is because a woman is said to have a limit to her reproductive age. For example, now, we say a woman's reproductive age group starts from between the time that when she starts menstruating to the time she enters menopause. And menopause usually, averagely, is usually at 52 years old. But some people enter menopause earlier than that. So a woman can actually enter menopause at 40 years old. This is what we call it's an early menopause, but notwithstanding, it's still menopause. So the age actually affects infertility in the sense that the older the woman becomes, the less likely she is going to be able to achieve pregnancy. Let's take, for example, now, a 24-year-old and a 36-year-old. A 24-year-old is still very young compared to a 36-year-old. If you really look at it, we have what we call the ovaries, okay? The ovaries are the ones that kind of control the fertility potential of a woman. And at some point, as the woman gets old, that's also how the ovaries also ages. So a woman that is 24-year-old is actually, in quotes, more likely to be more fertile than the one that is 40 years old due to the declining function of the ovaries. So the age can actually affect fertility. So a woman that is 45 years old now can have difficulty in getting pregnant than a woman that is 22 if all things are equal.
Okay. So what are the different types of infertility we can see in a woman?
So infertility can actually be divided into two types. You have primary infertility and secondary infertility. In primary infertility, it means that the woman has never gotten pregnant before. She has never been pregnant in her life. In secondary infertility, it means that the woman has gotten pregnant at some point, irrespective of what actually happened to the pregnancy. So she was pregnant in the past, but now at this moment, she's trying to get pregnant and she cannot get pregnant. So those are the two types. So we have the primary one, when the woman has never gotten pregnant before, and secondary, when the woman has gotten pregnant before, but now she's having difficulty in getting pregnancy. So those are the two types, primary and secondary infertility.
Okay, so are we saying the secondary infertility, a woman that has gotten pregnant before, has a child, and the second time she's trying to, are we saying the woman already is infertile?
Yes, what I'm saying is that a woman that has secondary infertility, she has gotten pregnant before.
Yes.
But now that's why I said, irrespective of what happened in the first pregnancy, it could actually be an early pregnancy loss, or she even had a delivery. A woman that has had a previous child before, and she's trying to get pregnant again, and is unable to get pregnant, that is a secondary infertility. It could be something happened after
the birth of the
first child that is now disturbing her from getting pregnant this second time. So this woman is said to have secondary infertility, irrespective of the fact that she had a child before. So that's why we are calling it secondary, because she has gotten pregnant before, as different from primary, where she has never gotten pregnant before. So a woman that has gotten pregnant before can actually have difficulty in getting pregnant a second time if things that causes infertility occur after that initial pregnancy.
Okay, now let's take a look at polycystic ovary syndrome as one of the things that causes infertility in women. Okay,
so polycystic ovarian syndrome, it's actually, like you rightly said, is actually one of the things that can cause infertility in women. And what is this polycystic ovarian syndrome? In polycystic ovarian syndrome, it's actually an ovarian problem, or let's put it like an ovarian dysfunction. Putting it in the layman's term, it means that the woman has what we call an anovulatory cycle. What does an anovulatory cycle means? In a woman that has polycystic ovarian syndrome, what it simply means that usually a woman every month, if you follow the normal menses, a woman every month is supposed to ovulate. And if she ovulates, that is what causes the release of the eggs that ends up being fertilized and the baby is formed, okay? But in a woman that has polycystic ovarian syndrome, this ovulation does not occur. And if ovulation does not occur, it means that no egg is released, is formed for fertilization to occur. And then the woman has difficulty with getting pregnant. So the main issue with women with polycystic ovarian syndrome is the fact that they have what is called an ovulatory cycle, which means that they are not ovulating. So that causes the issue of, because if a woman obviously does not ovulate, that means there is no release of egg, and then she will not be able to get pregnant. So that's the main problem that happens with polycystic ovarian syndrome, and it's actually a cause of infertility in women.
Okay, now there's this study that says women, they don't actually know that this type of infection actually exists. Now, can this be cured?
The polycystic ovarian syndrome. Yes. Usually, the polycystic ovarian syndrome, like I said before, it's an anovulatory cycle. That means the woman is not ovulating. And to correct, is not an infectious process. Okay. It's something that causes infertility. So it's not necessarily an infectious process. Okay. So for women that have polycystic ovarian syndrome, usually there are a lot of things that can make them actually present to the gynecologist. One of them is the inability to achieve pregnancy. Okay. So if a woman presents to the gynecologist with the complaints of I want to get pregnant, I cannot get pregnant, some investigations are done, and then if the problem is the problem of, let's say, it's actually the treatment of polycystic ovarian syndrome depends on what the patient actually wants, because most times some of them can have menstrual irregularities. Maybe this month they see their menses, next month they don't see, another 3 months they don't see the menses. It's after like the 4th month they see the menses. That is one presentation of polycystic ovarian syndrome. The other one is the one that, okay, the woman actually wants to achieve pregnancy. So for a woman that has polycystic ovarian syndrome and would want to achieve pregnancy, you can actually do what we call ovulation induction for this woman. Okay. Because the problem, like I said before, with women that has polycystic ovarian syndrome is that, in quotes, they are not ovulating. So you give them drugs that can help them ovulate, and then that probably will help them get pregnant. If it's other issues that they are trying to treat, like the menstrual irregularities, like those ones are not trying to get pregnant, they are just having menstrual irregularities, then you can also give them some medications to help them regularize their menses. And the most important thing with women that have polycystic ovarian syndrome, it's almost that most of them or some of them tend to be on their weight tend to be like overweight, kind of. So this kind of women too, you can also encourage them to lose weight. So that when they lose weight, the issues with the ovarian function can also improve. So coupled with weight loss and then giving them drugs for ovulation induction, it can actually help them to get pregnant.
Yes, that was the second question I wanted to actually ask you. If a woman's lifestyle can actually cause this infectious disease?
The woman's lifestyle, like I said, is not an infectious disease. The polycystic ovarian syndrome is not an infectious disease. Like I said, it's not like polycystic ovarian syndrome is not like malaria that you are bitten by mosquito and then you get the infection or something. It's something that is inherent. Infertility. It's something that is inherent. Sometimes this polycystic ovarian syndrome, they are actually hereditary stuff that you are actually born with it, okay? But there are some things, there are some lifestyle modification that you can actually do that can help with controlling of the symptoms. Like one of them I said is weight loss. Because most times you find out that most times the symptoms are more pronounced in people that are obese and all that. So lifestyle modification like exercise, trying to reduce weight, we actually help improve the outcome of patients that have polycystic ovarian syndrome.
Okay. Yeah. Now, what about food intake?
If it affects the...
No, if it can help. Are there some kind of food you can take, like fruits and all of that you can take to...
The important thing is to eat healthy. That is the most important thing. It's not like there is a prescription that if you eat eba, it's going to help with, it's going to make your polycystic ovarian syndrome disappear. Do you understand? It's not like if you avoid drinking Maltina or you avoid drinking Coke. But the important thing in this one is to eat healthy and then to help to exercise regularly, reduce the body weight. It will help to improve the functions of the body.
Now when a patient comes to you and says, doctor, I'm experiencing some certain things, some certain signs in my body, I've been trying to get pregnant and all of that, what are the signs you look out for?
For a woman that presents to us in the clinic with the complaints of
trying to get
pregnant, she has not been able to get pregnant. After seeing the woman, there are some basic questions that you need to ask her. Like, for example, now, how long has she been trying to get pregnant? Another thing that is very important in this whole discussion is to actually find out, because you cannot, to actually find out if she has regular sexual intercourse. Because sometimes you can be married, but you're actually not living with your husband. Your husband works somewhere or somewhere else, and you're staying here, and probably you only get to see like once in 6 months or once in a year. In that aspect, you know that something is actually wrong. No regular sexual intercourse, okay? And then those are the things you need to find out. If there's anything of such, then there are other things that you need to find out, because usually infertility is caused by different things, okay? It could be caused by, like, let me just say that infertility can actually be from a man or from a woman, because it takes two people to make a baby. So the problem can actually be either from the man or from the woman, okay? So if the woman presents now, after asking her some questions, another thing you want to also ask her is, when you look at different things that cause infertility, number one of the things is if there's a problem with the fallopian tubes, okay? And the fallopian tubes is actually where the baby is formed before it is taken into the womb. So if there's any problem with the fallopian tube, then the woman cannot get pregnant. So there are some things that can cause problem with the fallopian tube. For example, if the woman has some kind of pelvic inflammatory disease before, like pelvic infection. So some of the questions you want to be asking her are the facts that, does she have any abnormal vaginal discharge in the past that is smelling bad? Does she have any pain in her lower abdomen? Okay, all those kind of things you want to ask. Has her body been hot with this kind of lower abdominal pain and the abnormal vaginal discharge that she's having? Then you ask her all those ones if she has anything like that. Then also another thing that is very important, you know, we said before in polycystic ovarian syndrome that the problem is that there is problem with the ovulation. When a woman ovulates regularly every month, you expect that she's supposed to see her menses every month. So if there's any problem in that, you also need to ask, do you see your menses every month? How many days do you see it for? Because a woman that is not menstruating most probably will not be able to get pregnant. So those are the things that you want to look out for. Then another thing you want to ask is also the fact that, does she have any water coming out of her breast? Some women, because of the same hormonal imbalance, they can have water coming out from their breast as if they are lactating, as if they have a child that they are breastfeeding. So that could also be the problem. Those are the things that you look out for. Then you also find out whether she has ever been pregnant in the past or not. Those are the things that you also watch out for. Then, like I said, that the infertility is not just the problem of the woman. You also need to ask questions relating to her husband. Does the husband have any erectile dysfunction? Is he able to achieve erection and sustain erection? Does he ejaculate when there is sexual intercourse? Is there any difficulty with sexual intercourse? All those kind of things you need to ask them. And those are the things you look out for before you can now say that, okay, this is what is causing the infertility or not. But you can, even after asking all these questions, you can only make a guess that probably this is what is causing this infertility. But at the end of the day, you need to do some tests to be able to say that, okay, this is probably what is causing the infertility. Is the problem from the man or is the problem from the woman?
Okay, now we talked about the secondary part of infertility for a woman that has put to bed before and trying over again. Now, what would you advise a woman that has gone through the 4 walls of the labor room and all of that, and is trying to get pregnant a second time, what would you advise a person to do?
For a woman that has gotten pregnant before and it's not able to get pregnant again, the advice is to come to the hospital to be investigated, because probably something went wrong after that first delivery. So some investigations needs to be carried out, needs to be done to actually find out where the problem is, so that if you can identify that this is what is causing her not to be able to get pregnant now, then you can prefer a solution to it. So such women need to be investigated.
Okay. What do you think about traditional medicine? Some women, they say, oh, okay, we'll go traditional. What do you think about it?
The thing is that the infertility, it's actually a condition that can be treated. We've heard of so many women that do traditional medicine, including putting of caustic materials into the vagina in order to achieve pregnancy. Most of these things are harmful. They actually causes some damage. In fact, some people have put caustic materials into the vagina that has caused some burns around the vagina, and even causes the vagina to be adherent together. And because of this, it creates more problem. And I think women should seek medical advice to actually try to find the cause of the infertility, so that they can be properly advised and properly treated for the infertility that they have.
Okay, would you say environmental factors can also cause infertility in a woman?
Environmental factor, like I said before, like there are different things that causes infertility. Okay, like I said, it could be from the man or it could be from the woman. Like the female infertility, it can be caused either because the tubes has problem, or the ovaries has problem, or even the womb itself has problem. Those are the things that actually causes infertility.
Okay, now can fibroid cause infertility?
There has always been this will I say a misunderstanding or a misnomer.
Lots of persons say,
yes.
oh, she has fibroid, so she
cannot get pregnant.
Yes. Oh, the fibroid is lying on this part of the stomach and all of that. So we want to know.
Uterine fibroid does not necessarily cause infertility. Okay, there are a lot of women that have uterine fibroid, and they have been pregnant. In fact, some of them have delivered. In fact, uterine fibroid is so common that if you take, like, let's say for example now, you take like 10 women now and you examine all of them, maybe 7 of them will have uterine fibroid, but they still go ahead and get pregnant. Okay, but a woman that has uterine fibroid, you need to also investigate her for other. If a woman has uterine fibroid now and she's trying to get pregnant and she's not able to get pregnant, just because she has fibroid does not mean that is the fibroid that is causing that is making her not be able to get pregnant. So you need to still investigate her. You still need to do some tests for her to know that, okay, actually when you have done all the tests, you find the tubes, you do tests for the tubes, you say that the tubes are open, you do tests in the hormone, everything is okay, the semen test is okay. And because the problem is most women have kind of, they feel that it's because of the fibroid they can't get pregnant. They go and do fibroid operation. At the end of the day, the fibroids are removed, and then they still don't get pregnant because the actual cause of the infertility was not noted before the fibroid operation. So not necessarily, uterine fibroid necessarily does not cause infertility. You need to look at the other things that can cause infertility. If you look at those other things and they are normal, before you can now say, okay, then you now think of saying, if the fibroid is very big, you can try to remove it. But you need to find the other causes of infertility. So many women many women deliver with the uterine fibroid. So you cannot say particularly that yes, that uterine fibroid causes infertility.
Okay, so you've heard it all from Dr. Sofiat Yusuf. If you're thinking, oh, I have fibroid, so I won't be able to get pregnant, please take it out of your mind and have a positive mindset that yes, you can get pregnant and carry your own child. If you just joined us, this is Healthy Living, and I'm your host, Oluije Oihokai. Our doctor is in the house with us, Dr. Sofiat Yusuf. Yes, let's go for a quick short break, and when we come back, we'll be asking our doctors. There are some women that they get pregnant, and all of a sudden there is a miscarriage. I will be asking our doctor, is that also a result of infertility? We'll be right back.
We are Nigerians. We have one history.
Yes, in the annals of Nigeria history, 1st of October remains indelible.
Because now that day we get freedom from our colonial masters.
Wow! Patriotic Nigerians, we have to celebrate or no need?
No need? Who talk am? If you no value freedom, ask our children wey suffer slavery for Obodo Ibo. Me, I go celebrate Nigeria plus myself because I no be slave.
Good talk. If you concur, let's rise on ITV Radio on air or Wewe Nigeria on 1st of October 2020 at 10 a.m.
Na so.
Ijoya, 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 awala nejo.
Benny.
No.
Oh, toi. Owewe Nigeriana featuring Best Owewerizer competition using indigenous music. Poem recitation on No Place Like Home. Maximum 2 minutes.
Record and send to itvbenin@yahoo.com on or before 24th of September 2020.
Let's go dancing. Ooh, la, la, la.
This program is partly sponsored by
Calvary Crown Academy with campuses at Ugbowo, Ogida, Ugbo GRA, and Ekawan Road. For 2020-2021 admission details, log on to www.calvarycrownacademy.com. Omoyege Cyril, CEO, The Prince Builders and Estate Developers Limited, currently selling plots of land at The Prince Builders Estate at Obage, Obayanto, Imasagbon, and Obaetin communities. Buy 10 plots and get 1 for free. Office address, Comfort Plaza, A4, Etiti, off Adesowa Road, GRA, Benin City. Or call 0815-171-1111. Scottish Post Limited, built on a passion for sport and impacting lives through post betting. Head office, 62 Arosa Street, off First East Secular Road, Benin City, Edo State, Nigeria. Branch office number 2, Futep Shopping Plaza, Refinery Junction, Efero, Delta State. Telephone number 0806-551-9458. And supported by Mother Care Shop, Mama Oyoyo, for genuine baby things at affordable price. Head office, 130 Upper Forestry Road. Branch office, 28 New Lagos Road, Benin City.
Aki and Popo Aluminium Enterprises. Head office, 128 Akpakpava Road. And branch office, 105 Akpakpava Road. Beside former Intercontinental Bank PLC, Benin City.
Muyi Line, 169 Uselu Lagos Road. Opposite Benin Technical Junction, Benin City. For transport services, Benin to Lagos, Port Harcourt, Warri, Bayelsa, Epoma, Auchi, Abuja, and other Niger Delta routes. God's Time Investment, 65B Mission Road, opposite Cook Road Junction, Benin City. Dealers in car AC compressors, AC fans, condensers, evaporators, vulcanizer, spraying compressors of all kinds. Edu Abroad Educational Services Limited, your gateway to abroad. Shop 35, Ede Shopping Plaza, 27 Airport Road, and 133 Agbo Road by Agbo Park, before Obed Junction. Processing admission and visa to the UK, Canada, Turkey, Ireland, Australia, Russia, and Netherlands.
Let's go dancing. Ooh, la, la, la.
Owewe Nigeriana.
Roll!
right, thank you so much for staying tuned. It's still Healthy Living on your darling station. All right, before the break, I did tell you we'll be asking our doctor in the house for women that have gotten pregnant, are pregnant, and all of a sudden there is this miscarriage. Now, is this as a result of infertility? Can this be attributed to infertility in the woman?
For a woman that is pregnant and suddenly has a miscarriage, there are different things that can cause miscarriage in the woman. When you're talking of infertility, infertility means that she has not gotten pregnant. So if she gets pregnant and she has a miscarriage, is a different thing that we are talking about. So now, it depends on how many months the pregnancy was when she had the miscarriage. Usually, if the pregnancy, and it also depends on how many times she's had the miscarriage. For example, now, if the commonest cause of miscarriage is probably some abnormalities in the fetus, and it also depends on the gestational age or how many months the pregnancy was. So if a woman presents now and she was pregnant and the pregnancy is like, let's say, 2 months old, and she has a miscarriage, we cannot actually say it's due to infertility because she's actually pregnant. So we need to now find out what is causing the miscarriage. If a woman has had more than 2-3 miscarriages, then we can also be thinking of why is this woman having this? We now call this one a recurrent miscarriage. Like I said before, depending on how old the pregnancy is, how many months the pregnancy is. So if a woman has 3 or more pregnancy losses at let's say in the first, because usually you divide pregnancy into trimesters. Yeah. You say is either first trimester, second trimester, or third trimester. The first 13 weeks that a woman is pregnant, or the first 3.5 months, you can actually say that is the first trimester. Then the next one that's from about 14 weeks to about 26 weeks, 27 weeks, you can say that this woman is in the second trimester, and after that you say is in the third trimester. So if a woman has a miscarriage in the first trimester, there are many things that can actually cause miscarriages in that first trimester. It could be that because sometimes when the babies are not formed properly, when they have some abnormalities in the baby, the body has a way of actually taking care of an abnormally formed babies, and they can actually end in a spontaneous miscarriage, okay? Or if there are some infections, it can also end in the miscarriage. Or sometimes the woman can have some medical conditions that she's not aware of. Let's say, for example, a woman that has diabetes, that there's an abnormal sugar level. It can actually lead to these miscarriages in the first part of the pregnancy. When we are now looking further into the second trimester, if a woman has recurrent pregnancy loss, let's say between the woman is like 4 months, 6 months. That's in the second trimester. She had this miscarriage now. She gets pregnant again. She has the same miscarriage at that age. Then we can be thinking of something we call a cervical incompetence. What do we mean by this cervical incompetence? It actually means that, the womb or the uterus is where the baby stays, okay? Then there's a part of the uterus that is called the cervix, okay? That place is supposed to be closed throughout the pregnancy. So in a woman that has this cervical incompetence, it means that that part of the womb that is called the cervix is actually weak. So it's not able to keep the pregnancy to to 9 months. So once the baby is getting big, because the that part of the womb that we call the cervix is weak, it starts opening up. It opens up, and then the baby comes out. That's another type that the woman can have a recurrent miscarriage. So that's what we call cervical incompetence. So that's why a woman that has this kind of presentation or this kind of history that, oh, doctor, when I'm 4 to 6 months old, I will just know that something is not just right. You have, you just see water and baby comes out. We know what to do with this kind of people, so that when she gets pregnant again,
it doesn't reoccur.
It will not reoccur. So what we do is that we actually now counsel the woman that when she gets pregnant again, she comes to the hospital. Once we can confirm that the pregnancy is okay, the baby is okay, we do a small operation for her, that we apply stitches to that cervix that I say is part of the womb. Is what we call like the neck of the womb. So if the neck of the womb is weak, the older the pregnancy comes, it can lead to pregnancy loss because it will open. So what we actually do is that by the time the woman is finishing our first trimester, like we said before, that is the first 12-13 weeks. After that, we will put a stitch that we call cerclage to help to tie the mouth of the womb, so that it can actually allow her to carry pregnancy to term. Okay. So that's another thing that can actually cause a recurrent kind of miscarriage. So once that is done and that is identified, that stitch can be put, and the woman is expected to carry the pregnancy to term.
All right, viewers at home, I know you have lots and lots of questions to ask our doctor in the house. You don't say, oh, I'm a man, I don't have any question to ask doctor. Could be that there's someone by your side and needs this information. So you just call in, and the numbers that you're seeing on your screen, just call in, and our doctor will be here for you to answer every question you want her to answer. It's free of charge, okay? Don't worry, no charges attached to it. Okay, and for the second factor, there is a primary and secondary. Now, how long should the secondary patient, the woman, try to get pregnant? How long should she try to get pregnant before she knows, okay, this is something I cannot handle, I need to go to the hospital? The primary one, you said, once a marriage is more than a year and the woman has been trying with consistent sexual intercourse. Now, for the second one, which is the secondary woman, the secondary factor, how long should she wait before she comes to the hospital?
Thank you. It's actually the same. It's actually the same duration from the time that she starts trying to get pregnant. It's also 1 year.
Okay.
But there are some peculiarity. For example, now it depends on the age of the woman. I think I didn't mention that before. It depends on the age of the woman. If a 24-year-old comes to you now and say a 24-year-old is trying to get pregnant, okay, and you can still give her that allowance of 1 year trying to get pregnant. But if you have a woman that is like, let's say 38, for example, she's just getting married and she's trying to get pregnant, you might not give that 1 year, because you know that age,
okay,
it's a factor in this lady. So you are not going to wait the way you are waiting for 24-year-old and a 38-year-old.
Okay. All right, Doc, please just hold on there. Hello, we have a caller online. Hello.
Hello.
Your name, please, and where are you calling us from?
Hello.
Hello, we can hear you loud and clear. Your name and where are you calling us from?
Good afternoon, ma'am.
Good afternoon. Your name?
Yes, ma'am. I wanted to ask a question about someone.
Okay.
Yeah, she has given birth to maybe like the baby is 6 months plus now, but she has not seen a monthly flow.
Okay.
Yes.
All right. So
A woman she gave birth 6 months ago and her menses has not returned. Is she breastfeeding?
She wants to know if it's as a result of an infection.
No. It's not as a result of an infection. For example, women that give birth, And usually it depends on many factors. If the woman is exclusively breastfeeding, okay, if the woman is breastfeeding, because of the breastfeeding, it can actually take time for the ovarian functions to return. So the woman might not necessarily see her menses immediately. Some people even take until they stop breastfeeding before they start seeing their menses. So it's not necessarily that the woman has an infection. No, if she delivers and she's breastfeeding, menses might not necessarily return. We know women have different they have different things. Some people will resume menses 1 month after they deliver. Some will resume 2 months. Some don't even resume. In fact, some will not even resume until they get pregnant for the next baby. So it's not like it's an infection.
Okay. All right. Back to our earlier question now. Hello?
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 Good afternoon.
Good afternoon. Your name, please?
My name is
Okay.
I want to ask a question. Someone's fallopian tube gets blocked. Is there any place to I don't know.
If the fallopian tube is blocked, the issue now is that the person will not be able to get pregnant, because like I said before, that one of the things that causes you not to get pregnant is if the fallopian tubes are blocked, because the babies are actually formed in the fallopian tube before they get into the womb. So if the fallopian tubes are blocked, the things that this person can actually do, I don't know whether you have heard of IVF before. That's in vitro fertilization. That means the baby is now going to be formed outside, and like in a controlled environment where the woman's egg is collected and the husband's sperm is collected and they are mixed together, and then the baby is now eventually transferred into the mother's womb. That can be done for the woman to get pregnant in a case where the fallopian tubes are blocked, for her to get pregnant.
Hello? Hello? Hello, good afternoon. Hello? Hello, good afternoon. What's your name? Mrs. Who? Hello, I can hear you. Okay, all right, go ahead.
There's one question I want to ask. Hello?
We can hear you loud and clear. Go ahead. Please turn down the volume on your TV set. Hello? Hello? Okay, all right. You can keep on trying, and certainly we'll get to pick your calls when it goes through. Back to our doctor. Now, some women, they will say, I have been trying and trying and trying and still no solution. Now, what would you advise the woman to do?
It depends on what the woman has been trying to do.
Okay.
You understand? Has the woman been investigated before for this infertility? What is the cause of the infertility? So it depends. You cannot have you've not gone to the hospital, you have not been investigated, you don't even know what the problem, why you are not able to get pregnant is. So you need to actually find out what the problem is, okay? Right. For we to know that, okay, this is the solution. So it needs to be investigated. That's basically it. It's not just enough that I've been trying. What have they been trying to do?
All right, hello? Hello? Hello, caller? Okay, we talked about the treatments. Now, what are the investigations that can be carried for this?
So, for a woman that has infertility, the investigations that should be done, like I said before, that infertility is both a man and a woman's problem. So, the man needs to be investigated and the woman needs to be investigated. The investigation for the man is a common semen test.
Okay, sorry, Doc, will come back to you. Hello? Hello, your name, please? Hello?
Hello?
Yeah, I can hear you.
Okay, my name is Vicky.
All right, Vicky, go ahead with your question.
Also, how does ovulation look like?
How does what?
Ovulation.
Okay. She says, how does ovulation look like?
It's not actually something that you look at and say this is how it looks like. You only know that, for example, now, a woman every month is supposed to ovulate, and then you try to, you know when you ovulate depending on the length of your menstrual cycle. For example, now, I might menstruate for every 30 days. If I menstruate every 30 days, that means my ovulation will fall on the 16th day, because from the day you ovulate to when you see your menses is actually a constant 14 days. Okay, so that's why some people that have 28-day cycle, their ovulation falls on the 14th, because if they ovulate on the 14th, it means that they are going to see their menses on the 14th day. But it's different for every woman. For example, if a woman has a 32 days menstrual cycle, that means from the day she sees her menses today and when she's going to see the next menses is 32 days. That means the ovulation, you are going to like subtract 32 days from 14 days for you to know that this is actually around what time that I ovulate. But sometimes people there are some signs that you can see to be able to say that, okay, probably I've ovulated. Sometimes there's something we call a mid-cycle pain. Some people can have some mild lower abdominal pain, not very severe. It can be mild. Then you can say, okay, probably ovulation is taking place. But it's not something that comes out that you will see and you will say, okay, I think I've seen my ovulation. It's not like menses. When you start bleeding, you now say, okay, I've seen my menses. It's not like that.
There are some persons that experience this slimy substance.
The thing is that according to your menstrual cycle, okay, it's because of the hormones that occur during the menstrual cycle, it actually changes the vaginal discharge. You know, you have different discharges, okay? Like for example, in the first half of the menses, you can just have a light vaginal discharge and all that. When you ovulate, it can become thickened. That does not necessarily mean that that is your ovulation that you saw. It's not like something came out. It's just that the hormones actually changes the way the discharges they are. So some people will say, it's slimy, it's thick, they probably have ovulated, which they are not totally wrong, because the hormonal changes.
Hello? Sorry, Doki. Hello? Hello? All right.
There is one question I want to ask.
Okay.
The question I want to ask is, what happens when somebody delivers one, they cannot deliver again, and the person has got all the tests. If they set the womb and everything is okay, what happened? I want to understand.
That you've done all the tests.
Which test?
They
Okay.
said the womb is okay.
Okay, doctor says which test?
Yes.
No, she wants to know the type of test you. Hello?
He went through all the tests. The doctor said the womb is okay.
Okay.
Is it only the...
For long now, no pregnant, nothing. After 8 years.
The thing is that it depends, like, it's difficult to answer that question, because you need to know which test has been done, what the problem are, what did they say the problem is. Do you understand? It's not just the womb that's like, it's not only the womb that can cause infertility. Have they looked at the tubes? Are the tubes fine? Are the hormones okay? What of the husband's sperm test? Is the husband's sperm test normal? Is when all these things are okay, then you can now say, okay, everything is normal and I'm not still be able to get pregnant. There's something we call unexplained infertility. Okay, in this unexplained infertility, it means that all the tests have been done. You've done you've done the tubal test, and they say the fallopian tubes are open. You've done the hormonal test. They say hormones are fine. There's no issue with your hormones. Your husband has done semen test. They are saying that the semen is okay, the count is fine, everything seems to be fine, but still you are not able to get pregnant. That is what we call an unexplained infertility. For such kind of patients, you can can actually give them some medication, either to give them drugs for them to ovulate, or if all these things have been done, then the other things that can actually also be done, you can actually offer the patient what we call, and after you give them drugs to ovulate and them to have time intercourse to see whether they will be able to get pregnant, and they still don't get pregnant, you can actually offer them other forms of assisted reproductive techniques like intrauterine insemination, for example, where you collect the husband's sperm, you give them some drugs, and then you inject the sperm into them to see if they can get pregnant. Other things that can be done, you can also do IVF, like I was saying before, like you collect the woman's egg, collect the sperm, mix it together and inject the baby into them. So you need to actually know, be investigated to know what the problem or what the issues are before you can now say, okay, this is the solution we are going to prefer for you.
Okay, there's this question that just came in and says, I have pain on my left, on my right part of my lower abdomen. Does that mean I'm ovulating?
Like I said before, that most times there's something we call mid-cycle pain. You can have some slight abdominal pain when ovulation has occurred, but there are other things that can actually cause abdominal pain. So if you're having pain in your right side or you're having pain in your left side, I think you need to be examined by a doctor so that you actually find out that you are not attributing the pain to ovulation. Meanwhile, you have other problems that needs to be attended to.
Okay. Hello. Good afternoon. Your name and where are you calling us from?
Precious from Benin.
All right, go ahead.
Yeah, I wanted to ask if it's normal to have a thick protruding vaginal area.
If it's normal to have what?
A thick protruding vaginal area.
I didn't hear that.
She says, hello, Precious.
Yes.
You said if it's normal to have a thick protruding vaginal area, right?
Yes.
Okay.
A thick protruding vaginal area, like something is protruding out of the vagina. I think you need to get it checked out to be seen, to see what is happening there. If something is thick and is protruding out, you need to be seen by the doctor to actually help find out what the problem is. Nothing should be protruding out of the vagina. If something is protruding out, then it should be checked out.
Okay. All right, so Precious, you've heard what Dr. Sophia had said. You need to go to the hospital. All right, this is much we can take on healthy living today. Big thank you to Dr. Sophia Yusuf for making sure you come to teachers, schoolers, educators on everything we need to know as far as infertility in women is concerned. Now, mind you, not just only women do have this problem, but we also have it in men. So husband, wife, please try as much as possible to come together in unison and go to the hospital to go check yourself. Doki, you have any last word for women out there?
If you have any of these issues, you have been trying to get pregnant, you have not been able to get pregnant, I think you should be investigated, find the cause, because it's something that you have. If you have a cause of something, then you can have a solution. So it's better to find out what the cause of the problem is so that you can have a solution and then you can be treated. I think the joy of every marriage or every mother or every woman is to carry their child. So get investigated and get proper treatment.
All right, so I'll be seeing you again next week for another exciting time on Healthy Living. Do have yourself a beautiful day. Bye for now.